Chapter 5, right? Chapter 5 talks about integumentary system. So when we say integumentary system, what do we mean by that? What do we mean by the integumentary system? Your skin, nails, and hair. So we already kind of talked about the skin a little bit. So we are gonna go over that today, like slide by slide. Okay. So when we say skin, part of the skin is basically your epidermis and dermis. So what about the hypodermis? Hypodermis is underneath the skin. This is not the part of skin. So when we say epidermis, that is your superficial region, right? The top region. So in the superficial region, what do you have? What type of tissue do you have? Epithelial tissue, right? In the superficial region, which is epidermis, is made up of the what? Epithelial tissue, consists of epithelial tissue, and they are also what? Avascular. They do not have any blood supply. So what about the dermis? Dermis, as we talked a lot about it before, when we say connective tissue, a lot of the time when we say connective tissue, what do we mean by the connective tissue? Connective tissue is basically a connecting tissue. They are connecting other tissues together. For example, a lot of the time you are gonna find your connective tissue underneath the what? Your epithelial tissue as a padding tissue. So your dermis is actually made up of the what? Fibrous connective tissue. They are vascular, they have a lot of blood supply, and they also have innervation. They also have nerve supply. Underneath the skin, you have the hypodermis or superficial fascia, which is not basically the part of the skin, but is just the subcutaneous layer deep to the skin. So not part of the skin, but share some common function. So what are they made up of? They mostly made up of the adipose tissue. So what is the function of the adipose tissue? They absorb shock and insulate, maintain the temperature, store nutrients, all this, right? They anchor skin to underlying structure, mostly muscle. Right underneath you have the what? Muscle. So when we looked at the skin, what do we see in the skin? What do you all remember about the skin that we have? We have the epithelial tissue, and then we have the epithelial tissue, which is making up the epidermis, superficial layer, and then you have the what? Dermis, made up of the papillary layer and the reticular layer. Papillary layer is your what? Top 20%, and bottom 80% is made up of the what? Reticular layer. So what type of tissue do you find in the papillary layer? Areolar loose connective tissue. And what type of tissue do you find in the reticular layer? Regular or irregular? Irregular dense connective tissue proper. So not only that, but also in the skin we have hair, right? We can see the hair shaft on our skin, and then we have the hair follicle in the dermis. With the hair follicle, what do we have attached? What is the name of this gland? Sebaceous gland. What is the function of the sebaceous gland? Secrete oil. Secrete oil. And then there is a muscle attached to your hair shaft. What do we call it? Arrector pili muscle. What is the function of that? It helps you to make your hair erect, or what? Help with the what? Goosebump when you are cold, nervous, all this. And then we have two types of the other gland. What do we call them? So we have two types of the other gland. In this picture, I do not see those glands though. We have two types of other glands. We call them sweat gland, right? Or sudoriferous gland. What are the two types of the sweat gland we have? Eccrine sweat gland and apocrine sweat gland. So when we say eccrine sweat gland, what do we mean by that? It's the gland you have all over your body and produces sweat. What about the apocrine gland? It is only present in where? In your axillary and then in anogenital area. And what do they secrete? Not only sweat but also some protein and fat, and that can be metabolized by the bacteria you have on your body. That is why you have body odor from the underarm or axillary region and the anogenital region. Okay, so do you remember we also talked about some receptor in the skin? How many receptor do we have in the skin? Two types of the receptor, right? So one receptor helps with the gentle touch, which is basically located between your epidermis and the papillary layer of dermis, right here, all these projections, inside the projections. What are the name of those? So there are many names of that receptor, right? Tactile corpuscle, mycenar corpuscle, okay? And then there is another type of the receptor we have deep to the dermis. What do we call that one? Lamellar corpuscle. Lamellar corpuscle, which is not responsible for sensing the what? Gentle touch. Instead, what do they sense? They sense the poking, like all the deep pressure, right? Okay, so that's pretty much all about your skin. So one thing we did not talk about during the lab is what are the different types of the cell you have in your skin. You have few different types of the cell. Number one is the what? Keratinocyte. Why? What is the function of the keratinocyte? They produces keratin protein. Do you know what is the function of the keratin protein? Do you know you have a keratin layer on top of your skin? What is the function of that layer? Prevent the moisture loss and protect you from the abrasion and all this. So keratin is a protein that gives the skin its protective properties. Main cell type of the epidermis, tightly packed and slow off. Okay. So next one is the melanocyte. Are you familiar with the melanocyte? When we say melanocyte, they are the one who produces the pigment called melanin. Due to the what? Amount of melanin you have in your skin determines the color of your skin, right? Okay. So this melanin, what is the function of that melanin? This is basically the nature's sunscreen. They are the what? Nature's sunscreen. They are going to protect you from the UV damage. Then you have the dendritic cells. So imagine your main function of your skin is the what? Protection. If it is protection, how are they going to protect you if they don't have any dendritic cell? So how do they protect? How dendritic cells actually protect? They are the star-shaped macrophages that are part of immune system. Do you remember a little bit about the phagocytosis we talked about in chapter 3? So when we say phagocytosis, what do we mean by that? They digest, they break down, right? Any foreign virus, bacteria, all this, right? So your dendritic cell, that is why you have dendritic cells on the skin. And then you also have those touch receptor, touch cell, your tactile cell or Merkel cell or mycenar corpuscle. They have so many names, so you probably have to know all of them because you don't know which one is showing up. Okay. Okay, so now who remembers that we have two different types of the skin? Everyone remembers, right? What is the one present on your palm? Your thick skin. And then here, thin skin. So you have thick skin and the thin skin. So how thick skin and thin skin different from each other? Thick skin has how many layers? 5 layers. You have to know the name of the layers. I did ask question about that. Okay. So what are the name of the layers of the thick skin from the bottom to the top? The bottom layer, which is one cell layer thick, made up of all the what? Made up of all the stem cell, melanocyte, keratinocyte. The stem cell, they can divide, right? They can divide because they can get the nutrients from the blood circulation present right underneath in the dermis, right? So they are alive, they can divide. After they divide stratum basale, what do? The new cells, they are gonna push it to the layer on top. What is the name of the layer on top of the stratum basale? Stratum spinosum. What is the name of the layer? Stratum spinosum. On top of in the stratum spinosum, they are very, very what? Alive, nice and happy. Then they move to stratum granulosum. When they reach the stratum granulosum, they start what? Storing all this keratin and then become flattened and only 4 to 6 6 cell layer thick, which is the and looks like granules. That is why they are called the stratum granulosum. And on top of that, if you have thick skin, what do you have? You have stratum lucidium. That stratum lucidium only present in what type of skin? Thick skin. So why the stratum lucidium gives you the whitish appearance on your thick skin? Because they have a protein called ilerin, which is transparent and whitish in color. Then topmost layer or the thickest layer is the what? Stratum corneum. Okay. When they reach stratum corneum, they are already dead. Okay. Those are the dead cells. So one more time, stratum basale, your deepest layer that is firmly attached to the dermis, consists of a single row of stem cells that actively divide, producing 2 daughter cells each time. One daughter cell journeys from basal layer to the surface, taking 25 to 45 days to reach the surface. And cell dies as it moves toward the surface. So what are the different types of the cell do you find in the stratum basale? Keratinocyte and some melanocyte and the tactile cell. Remember, right underneath the stratum basale, you have the tactile cell. Then you have the stratum spinosum. So what is happening in the stratum spinosum? After you do the division of the stratum basale, the stem cell that's gonna go to the stratum spinosum, there are several cell layer thick cells attached via desmosome that allows them to resist tension and pulling. So keratinocyte in this layer appears spiky, so they are called prickle cell. That is why they are also called spinosum. Spinosum means what? Spine, right? Spinosum. So scattered among the keratinocytes are abundant melanosome and dendritic cells. Okay, so the next one, stratum granulosum. So 4 to 6 cell layer thick, but cells are flattened, so layer is thin. Cell appearance change, cell flatten, nuclei and organelle disintegrate, keratinization begin, and cell accumulate granules of keratin, a water-resistant glycolipid that slows the water loss. And cells above this layer die, too far from the dermal capillaries to actually survive. So if you are looking at the thick skin, you have specific layer for the thick skin, which is called the stratum lucidium, found only in the thick skin, consists of thin translucent band of the 2 to 3 rows of the clear, flat, dead keratinocyte, and filled with the illidin, as I told you, the protein, which is a translucent, that is an intermediate in the keratin maturation. So topmost layer, the thickest layer, because they have 20 to 30 rows of the flat and nucleated keratinized dead cells, accounts for 3/4 of the epidermal thickness. Though dead cells still function to protect deeper cells from the environment, prevent water loss, protect from abrasion and penetration, act as a barrier against biological, chemical, and physical assault. So human can shed around 50,000 cells every minute. So you have all these dead cell. Do you, a lot of the girls, we are like, so what, we all want to, we don't want to wait until they actually shed naturally. We want to use all these exfoliants, chemical exfoliants, all these physical exfoliant to what, become more bright and become more what, shiny. Yeah, right. Okay, but it's happening naturally anyways. Okay, so we do know about all these cell, right? And right on top of your dermis, what is the layer, what is the name of the layer which is right on top of the dermis? I want you all to talk, you have to write it in the exam today. Right on top of the dermis, what is the name of the layer? What is the name of the layer of the epidermis? This layer, the bottom layer of the epidermis. We have been talking about that again and again, many times. Stratum bacilli, right? Right on top of the dermis, what is the layer? One cell layer thick, stratum bacilli. Right on top of the stratum bacilli, you have the stratum spinosum. Right on top, this granulated stratum granulosum. And then the thicker most superficial stratum corneum. If you are looking at the thick skin, what do you have in between the stratum corneum and the stratum granulosum? You have the stratum lucidium. So one thing I want you to understand here, we know that the stratum bacilli is the what? Very thin layer, only one cell thick. So we know that this is the thin layer. But stratum spinosum is pretty thick. So this whole blue part is the stratum spinosum. But stratum granulosum, even though they are what, 4 to 6 cell layer thick, but they are still very thin because they get flattened. Okay, and then if you are looking at the thick skin, you have stratum lucidium between the stratum corneum and the stratum granulosum. And what about the stratum corneum? That is the thickest and superficial layer. Okay, now you have to tell me, I'm not telling you. What are the layers of the epidermis starting from the surface of the skin? Surface of the skin. Corneum, lucidium, granulosum, spinosum, basally. You have to write it down. Make sure you know the spelling. Okay. So which type of skin lacks a stratum lucidium and is found covering most of the body? Which type of skin lacks a stratum lucidium? Thin skin, right? Describe the different types of the cells found in each stratum of the epidermis. So what type of cells do you find in stratum bacilli? Keratinocyte, melanocyte, and the tactile cell. What do you find in the spinosum? Keratinocyte mostly, and some dendritic cell. On top of that, you have the what? Granulosum. What do you find in the granulosum? Of course, keratinocyte. They have all the keratin and become flattened. Okay, so now let's talk about in which stratum are the keratinocyte alive. Definitely stratum bacilli, yeah. Okay, so now right underneath your epidermis, you have the dermis. Dermis is the what? Strong, flexible connective tissue. Cells include fibroblasts, macrophages, and occasionally mast cells and the white blood cells. So they have different type of the fibers. Fibers in the matrix bind body together, makes up the hide that is used to make leather. Contains nerves, blood vessels, and lymphatic vessels. Contain epidermal hair follicles with arrector pili muscle, oil gland, and sweat gland. So they have two layer, papillary layer and the reticular layer. So when we say the papillary layer, they are made up of this right here, right underneath. So this layer is right here is the papillary layer made up of the areolar loose connective tissue proper. So when we say the dermal papillae, superficial region of the dermis that sends the finger-like projection. So these are the what? Dermal papilla. Okay, because they are making the finger-like projections. They are almost trying to protrude the what? Epidermis. So projections contain capillary loops, free nerve endings, and touch receptor, tactile corpuscle, also called the myciner corpuscle. So now let's talk about something important. Do you know that we all have a very unique fingerprint? Yeah, okay. So this fingerprint, what is this fingerprint? First of all, I want you to understand that if you look at your palm, you can only find them on your thick skin for sure. So when you look at your palm, what do you see? You see that your skin is like not 100% smooth, right? They have a lots of what? Friction ridges that helps you with the what? Gripping capability, right? That helps you with the gripping capability. However, on top of the what? This friction ridge, you have the what? Sweat pore. Those sweat pore, the way they are organized on your friction ridge is different from each other, and that is how they can be used as a what? Unique fingerprint and identifying characters. So it's not only the friction ridge, but also the sweat gland on top of that is going to determine the fingerprint. So one thing I want you to understand here is if I give you a scenario, we know that all of us has a very unique fingerprint, right? Do you know that the fingerprint pattern could be very similar to the identical twin? Yeah. If it's that, so what does that mean? So this fingerprinting is determined by the environment, biochemical characteristics, or genetics. Your genetics, right? Your genetics is going to determine your fingerprint pattern. So now the bottom 80% is made up of the what? Reticular layer. And what type of tissue do we have there? You can see dense, irregular connective tissue proper. And they have a lot of fiber like elastic fiber provide the stretch recoil properties. And then you have the collagen fiber to provide the tensile strength, bind water, keeping skin hydrated. And then cutaneous plexuses, network of blood vessels between the reticular layer and the hypodermis. They also have glands, hair follicles with the arrector pili muscle. You do find all of them in the reticular layer. So now, if you want to become a nurse, or maybe you want to work with a surgeon, or maybe you want to go to medical school and become a surgeon, you need to be very aware of the what? Cleavage line. So the reticular layer are caused by many collagen fiber running parallel to the skin surface. Those what? Collagen fiber, the way the collagen fiber is going in your body, you can actually see them. If you look at your skin, you are going to actually see them if you want to look at it very closely. Okay. So for example, whenever a doctor is trying to do a surgery and they want to do the dissection in your body, if they do the dissection parallel to the cleavage line, it's gonna heal more quickly. So that is why this cleavage line is very important to understand. And who is determining the cleavage line? The collagen fiber direction on the reticular layer. Okay, so how about the flexure line? Flexure line and the fingerprint is not the same line, right? When we say flexure line, what do we mean by that? Are you all familiar with the palmistry? So what are these different type of the lines in your hands is talking about? These are the what? Flexure lines. So you have this on your palm, you have this in here, right? These are basically the flexure line. So where is it coming from? Also coming from the reticular layer are the dermal folds at or near the joints. These are the folds near the joints. Okay, however, if you stretch your skin so much, what can happen? That usually happen a lot with the what? Pregnant women. Whenever they're pregnant, due to a lot of stretching, they can have a what? Stretch mark. And then this stretch mark, we call it what? Striae. Now, do you remember, did I talk about the second degree burn? Yeah, second degree burn do the what? Second degree burn can separate your, damage the epidermal layer and the papillary layer of dermis. And they can also produce the blister. When we say blister, what do we mean by that? The separation between the epidermis and the papillary layer of dermis. That is the blister. Okay, so the subcutaneous layer, hypodermis and superficial fascia, not part of the integument. However, they have the areolar and adipose connective tissue. So they have the subcutaneous fat in areas of more adipose tissue. What is the function? Pads and protects body, acts as energy reservoir and provide thermal insulation, site of the drug injection. Now, let's talk about the skin color. As a physician, a lot of the time, by looking at the patient, they can actually decide what type of diagnostic test they can actually suggest, right? So, the color tells you a lot. The color of the skin tells a lot about your body, right? So, we know that main pigment in your body is the what? Melanin. This melanin could be two different type, reddish yellow to brownish black. Okay, which one you have and how much melanin you have, that determines the what? The color of the skin. On top of that, there are more pigments like carotene, yellow to orange pigment acquired from the yellow orange vegetables, and the hemoglobin pinkish hue of the fair skin is due to lower level of melanin and hemoglobin binding of the oxygen. So this melanin, let's talk a little bit more about the melanin. So we know that the amount of melanin determines the color of the skin. What if you have the freckles and pigmented moles, are local accumulation of the melanin? So when we say, when we look at the what? Anything wrong? Oh my goodness. Is it a big one or the small one? Oh my goodness. So So what does the color of the skin tell you about your body? Okay, so if you have cyanosis, which is blue skin color, low oxygenation of the hemoglobin, and paler, blanching or pale color, anemia, low blood pressure, fear and anger, and erythema, redness, fever, hypertension, inflammation, allergy. And what about the jaundice, liver disorder? You are gonna see yellow sheen color. So pale color, anemia, redness, fever, hypertension, inflammation, allergy, jaundice, yellow cast, and cyanosis, blue skin color, right? Okay, so now let's talk about the glands, sweat glands. So another name of the sweat gland is what? Sudoriferous gland, sudoriferous gland. So as I told you, remember I told you that we have two different type of the sweat gland, eccrine and the apocrine. And how many eccrine gland do you have in your body? Million, 3 million, everywhere in your body. In terms of the presence of what? Eccrine gland, you are a what? Millionaire. And then in terms of the presence of number of cells you have, you are what? Trillionaire. Does anybody care? Nobody cares. You can tell everyone, go and everyone to tell everyone, I'm a millionaire. Then how? Then tell them. I have 3 millions of eccrine sweat gland, right? Okay. So eccrine sweat gland, apocrine sweat gland, and then contain the myoepithelial cells, contract upon nervous system stimulation to force sweat into the ducts. So now let's talk about when we say eccrine sweat gland, they are what? Merocrine. That means they secrete the sweat by the exocytosis. Okay, so we have all these three different types of the gland. I'm sure you guys already know all the differences, right? Can you tell me which one is what? What about this one? This blue one right here? Eccrine. What about this one? Sebaceous gland. And what about this one? Apocrine. Okay. So there are some other glands in our body we have, like your mammary gland, secrete milk, and then you also have the what? Ceruminous gland, which secrete cerumen or earwax, right? Okay. So now merocrine sweat gland. What is the name of the merocrine sweat gland one more time? Your eccrine sweat gland. Okay, that is the what? Merocrine sweat gland. Are you all writing the question to ask though? Yeah? Okay. Make sure you do it because you have to play the game. Okay. So now let's also talk about something important. I'm sure everybody in some time of your life probably experienced the presence of acne on your skin. Have you ever? Yeah, if you have experiences, do you know why you have acne? You have acne because of the overactive sebaceous gland, not sweat gland, sebaceous gland. That sebaceous gland, if they have infection, they can cause acne. Usually the bacteria called propionibacterium acne infection. And we are all familiar with the white heads. These are basically the blocked sebaceous gland. Whenever they get oxidized, they turn into blackheads. Okay. And have you ever see a cradle cap or seborrhea in a kid? It's because of the overactive sebaceous gland. Okay. So now your turn to tell me, the dermal papilla are part of what layer of the skin? Dermis, right? Should a surgeon generally cut perpendicular or parallel to the cleavage line? Parallel, okay. Which gland secretes sebum? Sebaceous gland, okay. So now we all know about the function of the skin. We know that the protection, body temperature regulation. Do you know that how your skin is associated with the body temperature regulation? Because they have all the sweat gland. By the sweat gland, change in vessels, perspiration. And what about the cutaneous sensation? The sensation, for the sensation, you have all this touch receptor. And then the metabolic function, they can synthesize vitamin D, activate hormones, stimulate collagen. And what about the blood reservoir? Can hold up to 5% of the body's total blood volume. Excretion of waste by the what? Usually by the sweat. Can secrete limited amount of nitrogenous waste such as ammonia, urea, and uric acid. And sweat causes salt and water loss as well. So now let's talk about the skin cancer. So most tumors are actually what? Benign. Do you know when we say benign and when we say metastasize? What do we mean by that? What is the difference between benign and metastasis? Benign is localized. They stay in, yeah, one place. What about the metastasize? They can actually spread from one place to another place. So, do you know what is the main important reason for the skin cancer? Is it genetics or something else? The most important reason is the what? Overexposure of the UV rays. Okay, so make sure you wear your sunscreen. Frequent irritation of the skin. So we have three different type of the skin cancer that we can have: basal cell carcinoma, squamous cell carcinoma, and melanoma. So when we say basal cell carcinoma, what do we mean by that? It's the cancer in the stratum basale, but this is not as malignant, least malignant, and most common, because stratum basale cell proliferate and slowly invade dermis and hypodermis, cured by surgical excision in 99% of the cases. Okay. Now, the next one is the what? Squamous cell carcinoma. If it is squamous cell carcinoma, what does that mean? This is the second most common, can metastasize, involves in keratinocytes of the stratum spinosum. Usually is a scaly red and papilla on scalp, ears, lower lips, and hands. Good prognosis if treated by radiation therapy or removed surgically. Do you know which one is the most dangerous one? Melanoma. Do you know why this is the most dangerous one? Because they metastasize very easily. Cancer of the melanocyte is most dangerous type because it is highly metastatic and resistant to chemotherapy. So treated by wide surgical excision accompanied by immunotherapy, key to survival is early detection. The earlier you can detect, the easier you can get rid of it. So how do you detect? To be able to detect, you need to understand the ABCD rule. So when we say ABCD rule, what do we mean by that? So if you have any bump or anything on your skin, the first thing you want to see if there is asymmetry. When we say asymmetry, what do we mean by that? Symmetry means you have all over the place, you have the what? Same appearance. But if you see in one side it is small, another side is bigger, what does that mean? It's probably saying that what? Asymmetry, probably a reason for, probably this is cancer, right? And then the next thing you need to look at is the B. What does that mean? Whenever you have a bump or something, you want to see the edge of the bump. If does it have any irregularity or is it smooth? If it is irregular, that's an indication that that could be cancer. And then color contains several color: black, brown, tan, sometimes red or blue. Okay, so if you see discoloration in your body, in your skin, that's also an indication. And the diameter larger than 6 millimeter. If it is larger than 6 millimeter, then you probably have to go see doctor. If you have any bump on your body, if there are like with ABCD rule, if you see that that's probably an indication of the cancer, definitely you should go see doctor as soon as possible. Okay, so now let's talk about the burn. We did talk about the burn a little bit before in the lab. So when we say burn, everyone knows what does that mean, right? I don't have to tell you. But whenever you have burned and you are going to see doctor, doctor has to actually identify how severe it is. So to be able to do that, doctor has a rule. What they do is they actually um, separate all of your body in broken, like break all the body parts in 11 section, and each section is what? 9% of the body surface, except the what? Genitalia. So they do not take into consideration of the genitalia. So now they try to find out how severe it is. But before that, let's talk about some three different types of the burn that we can have. So when we say first degree burn, what do we mean by that? The burn which damages only the epithelial tissue, which is the first layer, epidermis, right? And then what about the second degree burn? You have epithelial and the papillary layer of dermis. A lot of the time you're going to see blister because they separate the epidermal layer and the dermal layer. And what about the third degree burn? They damage all of your epidermis, and dermis can probably also go to the what? Hyposubcutaneous tissue. So now one thing I want you to understand right here is when you have third degree burn, would you be able to feel pain? No, because you are damaging the nerve ending that are present in your dermis, right? So now how your physician would determine how critical it is. If you have more than 25% of the body has second degree burn, more than 10% of the body has third degree burn, usually considered very, very critical. Face, hands or feet bearing third degree burn. So these also considered very, very critical. So in that case, what can you do? You can remove the skin, remove the burned skin, definitely use antibiotic because you are totally open right now. You are prone to so much of infection. Definitely you have to use a lot of antibiotic. And temporary covering, a lot of the time you are gonna be probably wrapped around properly. And then skin graft. Do you know what is skin graft? Yeah. Yep. Good. You guys know it. Good job. Okay, so now let's talk about the skin and aging. Skin and aging. So when we say skin and aging, I started to age and then I started seeing the differences in my skin already. So what type of the skin changes we usually get to see? First of all, do you know that we have the stratum basilae, which is always dividing? That division starts to slow down, first of all. Second is what? All the elastic fiber you have, you start to lose the elasticity, right? And then you have less sebaceous gland activity. So what does that mean? You have less oil for the protection, right? And then you lose the elasticity. That's why you have wrinkle, and subcutaneous fat also decreases, and increased risk of cancer due to decreased number of melanocyte and dendritic cells. And here starts thinning as well. So ways to delay aging: UV protection, good nutrition, lots of fluids, and good hygiene. What did you learn? What are some functions of the integumentary system? Body temperature, protection, we know about that. Synthesize vitamin D. What else? Nothing else? So many things. How many do you remember? Sensation, very good. Secretion, filtration, right? Okay. So which type of skin cancer is most likely to metastasize? Melanoma. Which type of burn affects the epidermis and the top of the dermis? That is your second degree burn. Second degree burn, which causes the blister too, right? That's all about the chapter 5. Yeah, are you all ready to ask the question now? Yep. Okay. So